I think we have a quorum. We're going to go ahead and get started. Let me introduce myself and welcome you all. I'm Bhadelia. I'm an infectious diseases physician and associate director, an associate professor at the Boston University School of Medicine, and the founding director of CEID, your host today, the Center on Emerging Infectious Diseases. We are really excited to have this conversation, which I've been giving a lot of thought to for the last few months since the outbreak is going on, H5N1 and what it will bring next year. And with us today are some incredible experts, Dr. John Connor, an associate professor of microbiology at the School of Medicine and at the National Emerging Infectious Diseases Laboratories. Dr. Jessica Leibler, the associate professor of environmental health at Boston University School of Public Health, and Dr. Jennifer Nuzzo, professor of epidemiology and the director of the Pandemic Center at Brown University School of Public Health. So let me start by putting a few framing slides on here, Jen, Jessica, Jennifer, and then I'm going to ask you each a question a couple of times, and then I have us end with a bit more framing of what might be going on from your perspective and what to expect, to ask really for your predictions. So to get started, just framing everybody who's here to where we're at currently, we have about 61 cases. The Louisiana cases presumptive H5N1 has not been confirmed, but otherwise we have about 60 cases, 2 of which have unknown exposures, including a case in Missouri and most recently a child in California who has a virus that's similar in its genotype to the virus that's been circulating among dairy cattle. Additionally, we have about 37 confirmed cattle farm exposures, dairy farm exposures, and 22 on poultry farms. When you look at where we're at seasonally, flu A, H5N1 is an influenza A virus. What might get more and more complicated is that we're starting to see the flu season kick in. You can see on the left, the CDC Flu View Weekly ending at the end of November. You're already seeing a spike in flu A cases. And so if there are more sporadic cases, really what we're seeing so far is more sporadic cases. There's no evidence of sustained human-to-human transmission. Those sporadic cases may be mingled in there as we're seeing those increase. On the right, you're seeing our epi curve of the number of cases with H5N1 in the United States. And you've seen October, November really saw a large increase. Majority of those cases are coming from California. And so December already, we're seeing quite a few cases and it hasn't ended. The month hasn't ended yet. Also wanted to show the wastewater data for H5. All the red dots on the left are places in the last week where there was detection of H5. And then the greens are those where they were tested, but there was no detection. And you can see, of course, as expected, California and some of the other cases where there are known dairy farm infections, but then also other in the Northeast states where you're seeing a wastewater signal. And we'll talk a little bit about this, where there has not been reported cases of dairy farm infections where the wastewater is positive. And then stepping back from a One Health perspective, just laying the scene of what these sporadic human infections are, what background they're happening against. On the right from USDA APHIS, you see the number of herds infected by month. In November, you're really seeing a large jump in those. Again, huge part of those are from California, but huge number of continued infected and affected herds that are on the dairy farms. And it doesn't end there. You're seeing a all-inclusive number of states where commercial flocks and backyard flocks have been affected. And again, these are not wild birds. There's just a caveat to say that our wildlife surveillance really could be better. It's spotty. It is not as widely sort of domestic animal we do a little bit better on. So, for example, there's a question in terms of the Louisiana case, there might have been exposure to a bird, a potentially sick bird. And so it's hard to sort of get a sense of beyond the commercial flocks, how many more wild birds might be affected as well. And on the right, you see a list of mammals across all the different states that are particularly wild mammals that are affected by H5N1. All that to say that we don't exist all of this is not existing in a vacuum. We are in a different reality than we were even a year ago. We have a lot more of this virus in our environment. And really that makes it a lot more important to ask the question of what happens next. So why don't I jump right into it? And I'm going to ask you, John, the first question by just say that the recent study that was published, that was funded by NIH, that showed that the barrier to H5N1 evolution towards greater human adaptation may be lower than we previously expected. I know that's been on a lot of people's radar. Can you talk a little bit about that research and how you're thinking about that issue?
Yeah, sure. And I guess to answer the question, I'm probably going to back up a little further to get us to right. How do we get where we are now? And so for me, the story starts when we first started appreciating that there was an H5N1 flu virus. And what we knew is that when we first started studying it, it was really good at infecting birds. It was not terribly effective at infecting humans, but it would infect humans under certain circumstances. And when that happened, it was very severe. And so that caused a lot of worry, but at the same time, super rare. So time has passed since we first started doing that. And what has happened to this flu virus, this H5N1 bird flu, is it is becoming, it has become better at being transmitted. Been better at becoming transmitted around the globe, being transported from Asia into lots of other places. And as time passed, more birds are becoming infected by this same H5N1. And so all that is saying, right, that the virus is changing. It is essentially going to the gym all the time and training to be better, and it's getting better at infecting more things. And because it's been largely restricted to birds, that's limited the overall interest. But in the last year, that's really changed. Right? So now what we know is that the virus is not just getting into birds, now it's getting into cows. There's been evidence that it's been getting into other animals, cats, dogs, mink. And so now what we are seeing is that this is a virus that used to only be really good at breaking and entering into bird cells and causing disease there and transmitting there. Now it's getting better at breaking and entering into a bunch of other cells. And as it is right now, it's still really good in birds at being transmitted. It appears to be pretty good in cows. There are an increasing number of human cases. The silver lining to that right now is that those cases look much like embers being spit from a fire that die out, right? They're cases, but they don't start wildfire human transmission. So that's good. However, the study that you referred to that just came out found that there's one, maybe a couple small changes that could change the way that the virus breaks and enter into cells that would make it really good at entering human cells. And that raises the concern that where we are right now is that we have seen a lot of breaking and entering in neighborhoods near us, but not our neighborhood. But now there appears to be the path to start all that breaking and entering in our neighborhood.
Yeah, I mean, I just following up with another question, John, about, the concern is people who hear about these sporadic infections say, look, all the recent human infections have all been mild. Why should I worry? Can you talk about why sporadic human infections still matter when we talk about viral evolution and the potential for this virus to, for example, become a master thief, as you painted your analogy?
Yeah. So the really nice part right now is that the disease transmission to humans has been really mild, and that is fortunate and great. What I think this raises it in terms of a worry is we already know other flus that are circulating. We already know that flu mixes and matches. And so first of all, just having another flu infecting us, I'm not super excited about that. But in addition, if we then get mixing like we did when the 2009 flu pandemic happened, what could happen is now we have mixing and matching that takes our existing immune systems sort of by surprise. And so that's one of the main worries about having yet another human infecting flu is that it can then become sort of a cobbled together new virus that we are not prepared for.
Thanks for that. And I wanted to mention to our audience, I see a question already in the Q&A. Please, throughout this just seminar, go ahead, feel free to start adding your question in there, and we'll try to approach them towards the end of the session as well. Jen, let me turn to you. Same question, right? We're looking at a scenario where there's 60 cases, minus the Canadian teen and the Louisiana case. You and I have often talked about the fact that this is a flu virus that's traditionally had a really high mortality. It seems like there's this tempering of a public health response, partly because of the mildness of the infection. Can you step back and just talk a little bit about where you see the biggest gaps in the public health response currently for H5N1, and then talk a little bit about what your concerns are with this potential, painting of H5N1 as being a mild infection?
Yeah, and maybe just to pick up on where John was heading with this. I mean, we've been watching this virus for a long time, and these recent cases represent a minority of the total number of infections that we have detected since we've been first tracking this virus over the span of 20 years. And if you just look across all of these cases, what we have seen in the 900 or so total cases that have ever been identified, about half of them have died. I mean, that is a stunning percentage. Is the denominator, is that 900 the total number of people ever infected with this virus? No. But when we have looked in population studies around outbreaks, we haven't found that, most of the town was infected and only these few people who got it were sick. We find typically that, maybe some additional cases are found, but it's not a lot. So I don't think that denominator is off perhaps by like orders of magnitude. So a 50% case fatality is quite stunning and really kind of puts this virus in its own category with some of the most lethal virulent strains that we've worried about. Now, why these recent human cases have been milder, we literally don't know. There are a lot of really interesting hypotheses out there, and some of them, have some kind of laboratory evidence around them. But some of them are refuted by other evidence, like when you take the virus from both the cow outbreaks and from birds, and you put it in animals, these animals typically die. So I think there's a lot of evidence for me that is not assuaging. And I do worry that we are over-interpreting on a small number of cases to project out and assume that future infections will be mild. Never mind the fact that the virus could actually mutate and become more virulent or more transmissible in all the ways that John just described. So I think when I look at what the response is, I think it's underpowered relative to what we still haven't been able to rule out this virus can do. And most of the ways that we're trying to protect people are, things like giving them medicines or giving them personal protective equipment. These are all important tools, but they are really hard to operationalize in a complete enough way to ensure that people who are regularly being exposed to the virus, and for me, the worry list, at the top of the worry list are farm workers who are going to have continued exposure to this virus, because you just see these outbreaks happening more and more on farms. When I think about the actions taken to prevent them, there's just too many holes. There's just too many gaps. It isn't a response that's oriented around, making sure we prevent severe illness and deaths that could very well occur. I think we have to maintain that posture until we have more evidence of why it may not occur. On Friday, however, someone, a case was hospitalized in Louisiana, or they announced that there's a hospitalized H5N1 case in Louisiana. There was also a teenager who was hospitalized in British Columbia. Teenager, no known exposure to animals and no known, health risks other than the current situation. That teenager is in critical condition. So I think we are, really kind of underappreciating what can happen. And, in epidemiology, it's always very risky to interpret a very small number of cases and say too much about it. It's hard for me to throw out the majority of other data points that we have seen up until this point. So around, if you ask me what's missing, I think we have to do more. And, in particular, I think thinking about more types of protection for farm workers that are less subject to gaps and holes. And in particular, I think we should be talking about the use of vaccines on a voluntary basis to give people protection against this virus so they don't wind up in the hospital or dead.
Yep. So if I understand you correctly, it is, you know, greater potential use of vaccines as a medical countermeasure, greater ability to sort of track people who may have this illness in case, and greater emphasis on trying to limit the spread so it doesn't get to humans in the first place.
Absolutely. And, you know, I mean, we'll talk a bit more about the kind of surveillance programs we have and the gaps with that. But I just want to say, I think the fundamental thing that's missing from our response is an appreciation that all the data we have suggests that this is not a good virus, that there are risks to allowing it to continue to spread relatively unchecked, and that there are real potential warning signs about what it could do to people. And so I think our response has to start first with the people that we know are being exposed to this virus, and that's farm workers. And I think the way that we've been protecting them, given that we keep seeing more and more infections, it's just not working. We need to do better.
So what a great transition to you, Jessica. And I see some conversation in the questions as well about the poultry industry versus the dairy industry. So far, majority of the human cases have been in what could be considered a medically vulnerable population, migrant workers who may not have same kind of access to health, same kind of access to information, language barriers, concerns about employment. What work have you seen? So since we last talked, we had this conversation back in June in our first session for H5N1, and we talked a little bit about the concern about reaching farm workers and the poultry workers. What work have you seen in the interim that gives you hope? And then where do you think those gaps are, to Jen's point about protecting that population?
This is a great question, and it's really important, specifically as we talk about how agriculture has changed and industrialized over the last 75 years in this country. The cattle industry industrialized a little bit later than the poultry industry. So some of the organizations and structure around protecting that workforce have come a little bit later than poultry workers in terms of infrastructure. I do think, despite some movement in terms of surveillance, some additional efforts to conduct surveillance in this population, the efforts remain fairly limited. One of the things that has given me some hope is engagement with the labor unions and engagement around strategies in particular to recognize the vulnerability of this workforce and to engage with them in their language, literally, to have multilingual individuals engaged in the community, reaching out. There have been some news media articles in the last week or two that worker concerns about losing their job have prevented them from engaging in some existing surveillance programs in California. Which is challenging and is difficult to hear. And this is the same thing we've been dealing with for many years in terms of thinking about surveillance for any kind of zoonotic pathogen of workers in these industrial systems, is that they face really steep economic and job-related pressures to, first of all, not be sick, to not take a sick day. In some of these locations, workers can lose their job for reporting sick. And so kind of there's pressure on not to say you're sick. There's also, you know, limited access to healthcare and to health infrastructure. And so these efforts need to kind of reach workers from that recognition, from that standpoint that they're vulnerable, and just kind of setting up shop in their workplace is not necessarily going to recruit a lot of people because there's a lot of risks involved. The labor unions have experience working with, especially on the production side of this workforce. Many of the workers who work directly in the farms are on smaller scale operations where there might not be that many employees. When we start thinking about many employees, we're thinking about production facilities like milking facilities or beef cattle slaughter facilities or poultry processing facilities rather than the direct animal houses. And some of those workplaces are unionized. So I think unions and kind of labor groups have provided an important voice, but surveillance efforts still remain limited, although there have been efforts to kind of reach workers more in their language, especially. with relevant materials and relevant messaging about the importance of the virus specifically for their communities and their families.
What I think is interesting is that, we've been paying attention to this vulnerable population, but now it seems like we're at the start of this precipice of these infections finding those that are nowhere near poultry farms and nowhere near dairy farms. And one of the signals that presented at the very beginning was wastewater, with this idea of positivity in wastewater without, potentially positive herds in that state. The California case or the Missouri case, in both cases, H5N1, really low levels of virus, by the way, in both cases, but confirmed to be H5N1. So lack of any exposures, John, can I ask you about the wastewater studies that are showing this positive signals? What do you make of the significance of these signals, and what are potential pitfalls with wastewater technology that people should be aware of? What does it mean, I guess, to find a signal for wastewater?
Right. So the idea of using wastewater to see if virus is circulating is a pretty good one, right? Depending on the circumstance. The idea is we get rid of a lot of stuff and a lot of it ends up in a wastewater stream, and looking to see if there are traces of H5N1 gives you an idea of whether it's in that waste stream. And from that standpoint, I think it's useful to note that it's there. However, projecting backwards to what it means, I think that's a lot harder, right? Like I struggle to understand whether it says that that milk that has influenza virus genome in it has been dumped down the sink, right? That may be fully inactivated virus and not pose a risk to anybody, but have been shipped from somewhere far away. It could be actual virus that is capable of infecting individuals and indicating somebody has been. It could be birds pooping in the waste stream that have H5. And
or wild animals. We just saw the mammals, the list of mammals and all this, right? Like it's unclear, right?
So I think it is an important data point. If we were talking about a virus that, for instance, just circulated in people and only in people all the time in people, it would be a lot simpler to understand what it means. But when it's a virus that can be in a bunch of different things at a bunch of different times, I think it's a lot harder to extrapolate back to what it means.
Thanks for that, John. One other way that we're potentially doing surveillance. So just step back to give folks a background of how the CDC and the US government is tracking this and how the states are tracking. Influenza network, right? ILI presentations, hospitalizations for H5N1, every sample of flu that's sent in that could be potentially non-typable flu A. In some states, in other states, it's a smaller proportion of those that gets genotyped for look for H5N1. So we're still potentially missing things there. The wastewater, one other way that we're tracking now that the FDA has announced, the USDA is sort of working with, or the government has announced the USDA is working with, is just the bulk milk testing. Jen, could I ask you potentially to comment on the bulk milk testing strategy, describe what it is as it's outlined, and potentially advantages and disadvantages of these approaches. And Jessica, if you have insights on that as well, I'd love to hear that.
Yeah, and I think it actually piggybacks nicely on the conversation around wastewater, which is that, what we're going to have to do here is sort of triangulate our way to the truth, where we have multiple different sources of data, none of which tell us exactly everything we need to know, but that kind of give us a general sense, and in some cases prompt us to ask more questions. And I think in the context of wastewater, that's exactly what happens, which is that it's a little bit like your smoke alarm. It goes off, you're not sure what's causing it to go off, but it does force you to kind of go and look and see. It's only as good, the system is only as good as the investigation that follows when the alarm goes off. I think in some places, the wastewater data, we do see a signal increase before we then see human infection. So I think it can be useful, but it all depends on, where we're testing and how much we're testing. And, in some cases, it turns out, when we find a data point that we want to ask more questions about, like a person who tested positive for H5 who was in the hospital in Missouri, many of the wastewater sites in that state weren't actually testing for H5. So it all depends on how the system. I'm using this as a little bit of an allegory here to talk about bulk milk testing, which is to say exactly that. I think the idea of testing milk in bulk, raw milk we're talking about, has demonstrated itself to be quite useful. It was initially rolled out by the USDA, I think kind of early summer, June-ish, on a voluntary basis to a handful of states. We know that other states have taken it upon themselves to test, and in some cases, like in Massachusetts, they didn't find anything. In other cases, they did, and it helped them. For instance, in Colorado, I think it's sort of credited with bulk milk testing has been credited as being part of its success in reducing the infections that Colorado had been seeing over the summer. So it can be quite useful. What is starting today is a mandatory testing protocol. I'm just going to put quotes around the word mandatory because rather than just offering voluntary testing that USDA started over the summer in initially 4 states, there is going to be quote unquote mandatory testing essentially in all states, but initially starting with 6. So the question is it useful? Yes, it can be useful, but what kind of contribution will it have in terms of identifying infections, being able to track where H5N1 is and where it isn't, and trying to stay ahead of it, trying to work backwards to identify farms so that we know if people have been exposed to the virus on these infected farms. It all matters how frequently it's done and what the total catchment of the surveillance system is. And there have been few details around that. And so, yes, I think it's important. I think it should have started much earlier. I think it should have been much more comprehensive, much earlier. I'm glad it's starting now. More in this case is better. But in terms of trying to stay ahead of this virus and trying to answer all the questions that we have, it is probably so far not going to be sufficient for what is needed. Again, I think we have to remember that this virus is not going away. And so just coming back to my initial smoke alarm analogy, which is like you don't dismantle your smoke alarm once the fire has gone out. And similarly, some of the bulk milk testing has been described as sort of being able to ratchet down when states are not seeing infections after a period of time. I think that's a mistake because I don't see this virus going away anytime soon, certainly not with the kind of efforts that we have, which are ramping up, but still not far from comprehensive. And so what we really need is comprehensive bulk milk testing in all states at all times until we have somehow decided that H5N1 is no longer something we need to know about. But I don't see that happening anytime soon.
So what a great setup for what I wanted to ask, and I think has been on one of my questions for 2025, which is this idea of like, will H5N1 go away, right? Great question. I'm going to step back and pose it to the audience for a second of like why we think it's not going to go away. I think most people you're going to talk to in the public health world, virology world, ecology world are going to tell you no. And the reason why is because it's in so many wild mammals, is circulating, you know, in so many domestic and wild mammals and birds. Not only that, but there are other serotypes of H5N1 all over the world. So even if we were to, you know, potentially eradicate it, here in a small amounts of areas. So then what's the goal of an outbreak of a response when we know it's going to be around, right? Because it might still be possible to eliminate it from close to our food source. It would still be possible for us to eliminate it where humans are to keep it from infecting us, which is really the biggest case. And I think, you know, that has been the stated objective of the U.S. government, is to reduce, of course, human infections and to protect our food security and to protect, you know, and to protect our ability to sort of cover the vulnerable populations within our country as well. So to that point, one of the questions for me in the 2025 has been, there was a lot of talk about H5N1 potentially being seasonal and then going away, right? Which hasn't happened. You've seen the numbers. It's only growing, the number of herds. The other unknown is reinfection, right? So influenza viruses in general don't breed long-lasting immunity, which is why we take vaccines every year, right? They change, they mutate, they are very mutagenic RNA viruses, and so change enough so potentially to get around that immunity part that vaccines may offer. for seasonal influenza. We don't know yet, right? I want to pose it to you guys about this question of reinfection with H5N1, because that seems to be critical in terms of being able to answer how long this virus might be a threat and how big a threat it would be. John, let me pose it to you and then open it to others as well.
Yeah, great. So I get to speculate wildly. I don't, so I think we just don't know enough. I think that reinfection is the least of our worries right now. And I say that because in terms of what the virus appears to be doing, what we have seen historically is that we've been hoping that H5N1 will go away for years now. I think especially the poultry industry has been hoping it will just go away for years now. In the same way that I keep hoping that weeds in my garden will go away. I come out and I weed, but a few weeks later they come back. And that's what we are seeing with this virus, is even with effective culling programs in poultry, the virus has not gone away. Even with assuming that it might be seasonal, we haven't had any success in that hope. And so I think there may be H5N1 immunity that could help damp it down, but I also think that the target is so huge right now that reinfection is not the thing I am deathly scared of. It's that the virus continues to come back. And like the weeds in my garden, I don't think next year they're not going to be there.
Jen or Jessica, thoughts from you guys?
Having a little bit of COVID 2020 flashbacks, because the same argument over it's going to go away. Is it seasonal? Is it, I mean, listen, first of all, we're talking about largely animals here, and on farms, it's not necessarily the same animals all the time. So if a cow gets sick and has decreased milk production as a result, that cow may be sold into the beef industry for meat, and then a new cow is going to come and replace it. So I think this idea of just, going away, I think in addition to the genetic reasons for why, reinfection may be possible, it's just we're having new susceptibles, right? New animals who are susceptible to infection all the time in these things. And I do think, though, that there was thoughts in the early stages of these outbreaks on dairy farms where some of the thinking in the ag side was, well, this isn't necessarily killing the cows, although I will say if you read the veterinary reports, these animals do get quite sick. And that there will just be this that'll just kind of wipe through and be gone. And even if the virus did give durable immunity, that's just, I don't think, and sorry, I'm a human health epidemiologist, not an animal epidemiologist, but just given what we have seen happen with these animals, I just don't think that that's a realistic scenario. So this virus is only really expanding in terms of geography. It's expanding in terms of species that it's able to infect. It seems to be gaining, to John's earlier analogy, I mean, it has spent time in the gym and it is gaining new skills. So I just think that really what you're hearing in that is just like a wish that it would go away, a hope that it would go away, but that's the strategy.
Yeah, so that kind of helps me pivot, Jessica, to you're going to respond to this, but as you do, I also wanted you to sort of focus on, we talked about the worker side of this, but Jen just spoke about the producer side of the equation as well. They're a major stakeholder, right? And so far, USG has been able to engage producers through dairy farm producers through reimbursements for lost herds, improving PPE access and testing. I know a lot of that has been of different success depending on the states that you're in. How successful do you think those strategies have been, and what challenges do you think remain? And are there strategies that haven't yet been deployed in terms of engaging producers as a major stakeholder in this, to be able to try to, again, meet that goal of decreasing infections in humans and potentially, eliminating it from our food source?
It's a great question. I feel like one of the real challenges in engaging food producers is their inherent interest in not diminishing public trust in the food product. And I think a lot of the policies that we might say, these are no-brainers from a public health standpoint of surveilling the food system, have and open up the possibility of undermining public trust in meat in milk, in dairy products, in these food products that are kind of critically important for public nutrition, but also are critically important for these industries. And I feel like those sorts of pressure are just now pushing on the industry as we talk about mandatory surveillance of raw milk. So this is milk kind of upstream of the pasteurization process. This is not kind of this exact form of the milk that you would buy in your supermarket that mostly has been pasteurized, although there is certainly a raw milk market, and that's been bandied about recently a lot in politics. But kind of that is not further processed that very well could have live pathogens in and is known to be contaminated with pathogens for a long time. I think that may serve as this consumer-oriented pressure on the food products and the public trust and the safety in our end consumer products is ultimately going to be I think the lever that really moves the producers towards action. I think there's a history of demonstrated behavior on part of the industries that the worker health, safety, public health component as it relates to viruses, for example, evolving in their industrial systems and then emerging through the workforce or emerging through the local communities has not really gained traction as something that is pushing movement on behalf of the producers. But they're very concerned about preserving public trust in the food system. And so I think that ultimately is the strongest lever from a public health standpoint, but that involves community, that involves activism, that involves social media. There's a lot of components of that, but I think very quickly it can spiral out of control.
Yeah, that's an interesting point, right? Of like, there's an interesting balance between trying to achieve public health goals, which is what we're trying to do in terms of controlling this virus, while maintaining that public trust in food, because we've already shown that pasteurization can help, kill any potential virus in this. Same thing with most of if you cook the beef, there is no virus. Viruses are actually very easy to kill as long as you have that. But the concern then would be those who are exposed to those products before they're processed. So not so much the consumers, but again, all the intermediaries and et cetera, all the other things. We didn't touch on raw milk. You touched on it, Jessica, but I want to go there because I get PTSD from 2022 because I feel like, it's becoming this new thing of like, oh, freedom. There's plenty of reasons aside from H5N1 you should not be drinking raw milk, Brucella, Mycobacterium bovis, like tons of bacterial infections that are terrible. But it's interesting with raw milk, we don't yet have there's a concern, but we don't have a sense. What we've seen is that, for example, cats who consume unpasteurized raw milk on farms tend to have horrible, severe disease, and many have passed away from that. And we're seeing many more paired domestic animals being affected that way. In humans, the impact of raw milk or H5N1 as a route of transmission, ingestion being a route of transmission, remains unclear. We're not sure what that means. Can you speak a little bit about your concerns about raw milk and where you see this going?
Sure. I mean, I think so there's raw milk in a few different forms, as we're talking about. There's kind of raw milk as a consumer product, which has been known for decades to be dangerous and contaminated with many pathogens, bacterial pathogens especially, viruses maybe the least of it, but is known as a public health concern. Raw milk also, as we think about kind of an unprocessed or unpasteurized milk product, is also a source, very likely, of transmission of virus around and between these industrial facilities. So in terms of when we think about what goes on in an industrial milking parlor, for example, it is not a very neat operation. We could say there's thousands of animals being milked. In part, there's workers involved, there's mechanization involved, there's robots involved in certain facilities. But there is a lot of milk that is coming out of the animals, and the facilities are shared. And the sorts of receptacles where the milk goes into after the cows are milked are also shared, and sometimes between farms. So you might have different herds of farms that are using shared equipment for milking, which provides a lot of opportunities for the unprocessed milk itself to transmit the virus among herds of cattle, and also to expose workers who are involved in those systems.
Yeah.
And then there's kind of the end stage raw milk product, which is its own kind of market and public health concern, as you were commenting on.
I'm going to do my framing questions in the next 10 minutes, and then I want to leave 10 minutes to just talk a little bit about the questions in our Q&A. So the whole goal of this particular webinar was, as John said, to just, put on thoughts wildly in terms of what might happen, but really educated guesses is really what I want to say. Educated guesses about what type of evolution we might see from this virus, what kind of impact on animals or humans are, around us we might see. So just tapping to all three of you, I'll start with you, Jessica, because we just started talking as well. So what is your current level of risk to humans? Do you feel that it's the same, higher, or lower than when we last spoke in summer?
To be frank, I feel like there's a greater risk now than there was when we spoke in the summer. And that's because of as both of my colleagues have referred to, kind of the devastating explosiveness of this virus now in wildlife. And avian influenza viruses have kind of circled the globe in wildlife and circulated forever. But not with the die-offs that we see now and the expansion of the affected species that we're seeing now by this H5N1 virus. And so we as humans are not independent from this ecological crisis that is going on, even if we're not aware of it in our day-to-day lives. The viruses like H5N1 or avian influenza viruses really are part of an ecosystem, and we are not independent of that viral ecosystem. And so I am concerned that as there's this tremendous introduction into all these different species and these huge die-offs in wild birds, that it just provides this constant opportunity for human exposure, and it's greater now than it was 6 months ago. And I think when you have these animal systems that are saturated by this virus, the question is, what happens from an evolutionary standpoint, where you have herds of birds that are experiencing die-offs, or large communities of marine mammals, for example? Will the virus mutate so that it's not killing off, so it's not quite so lethal, and doesn't totally decimate all the organisms in the system? That provides some kind of, an evolutionary pressure to become maybe less lethal, less obvious from our surveillance systems and our surveillance standpoints. And so that poses a concern also.
Jen, same question to you. Higher, lower, the same, and what do you predict for 2025?
Yeah, so I think of the concerns in two categories. One is like, are you going to get the virus that's circulating today? And I don't walk around thinking I'm going to get the virus. I don't, unless you are someone who has regular exposure to animals that we know are likely getting infected with this virus. And I don't put that on your worry list. I don't let my kids go and play with dead birds, but I've probably never let them do that. So I still think the risk of acquiring the virus that's circulating today is quite low. I don't love the fact that we are now seeing cases pop up where there isn't a known exposure to animals, but those are still rare. So the other area that I have worry about is, can this virus change to become a pandemic? And my worry is increasing on that front, because it is showing itself capable of doing new things. And also, in addition to the mutations that John talked about earlier, there's also the possibility of a recombination, a reassortment with a human flu virus in this flu season that was mercifully late in starting, but is starting. So I have a bit more concerns there. I am very worried about farm workers. I feel like I'm, going to say that thing over and over again. I'm very worried about farm workers who continue to get sick, and I do worry that it's only a matter of time before we see more severe illness among farm workers. So that is the top of my concern. But otherwise, concern is slightly ratcheted up. But otherwise, I don't think people need to worry about this in their day-to-day lives.
Yeah, low risk for the general population, higher risk for those occupationally affected. And I share your concern about the wider the net is in terms of infections, potentially this virus finding medically vulnerable folks who may not have the same kind of, course. John, same question.
Yeah, I think I don't have a whole lot to add, right? Both of the prior answers I think are spot on, right? Am I worried that I'm going to go out and get H5N1 flu when I go grab my next gallon of milk? I'm not. But at the same, in terms of answering the direct question, like is the risk higher now than it was in the summer? I think it is a little. And not that I am seeing the barbarians at the gate yelling right now, but it does seem to me a little eerie that in 2009, we discovered that there was a bird virus that went into pigs, and then somehow it reassorted, and then it became the 2009 pandemic. Now we have a bird virus that's circulating in cows, and right, I think we can think through
Sporadic infection in pigs.
Right, and we can think through that and see that there is a similar risk. I'm not saying it will happen tomorrow, but I think this is the point at which everybody should sit up and think, gosh, this is something we probably want to be prepared for, rather than thinking that it's just going to sunset.
All right, good transition to that last framing question I wanted to ask before we open up to the Q&A. So we have a new administration coming in next month. And, you know, I'm going to caveat this by saying the U.S. public health system, as all of you guys know, is a federated affair, right? The federal government can do certain amount of things, can impact priority, can invest in research, but states do majority of the public health work, which is why we've seen such a difference take both in COVID response and now H5N1 response in terms of how it's dealt with at the state level. So having said that, if you were advising the incoming administration, Jen, let me start with you. What would be your recommendations as priority actions?
Yeah, so first of all, I mean, I think we have underassessed the economic threat that this virus poses. And, you know, part of the reason why there's been a very aggressive response to H5N1 in poultry flocks has been because it's been lethal to birds, and there has been a real imperative on preventing the spread. There have been some financial incentives for dairy farmers, but in general, I think that the economic aspect of this has been underappreciated. You know, if the price of beef changes such that, you know, selling off your sick dairy cow to become beef is no longer financially feasible, if we deplete the funding that's available to farmers to be compensated for lost milk production, again, this virus is not going away. So this is a long-term threat. I do really think that we have to expedite this bulk milk testing and make sure it is much more comprehensive and consistently timely than it has been to date. I also do think we have to be, you know, planning around H5N1 vaccines. I would prioritize offering them, not mandating them, offering them to farm workers of all types as a form of protection against this recurring occupational hazard. But we also have to explore what would be necessary if this virus really took off and started a pandemic. Other countries are putting in orders, and you know, Finland is already vaccinating its farm workers, so we don't want to be last in line for these things. So I would really point to that. And then the other thing I'll just flag, because we talked about wastewater testing, you know, wastewater testing funding could sunset. And so we really need to think about maintaining that as the durable infrastructure, just like we change our batteries and our smoke detectors, you know, every year. We have to think about maintaining and enhancing that infrastructure so that we stay ahead of this virus, not 2 steps behind it.
Jessica, same question to you.
I agree with Jen's response, and would add one component that I think something that would be really important is to pull in workers into the plans for their own protection and their own health and safety, and engaging organizations, engaging unions, engaging groups that reflect their needs, their employment situations, their languages, their realities. It's really important to make sure that whatever sorts of interventions are proposed, from vaccinations to PPE, that these are able to be implemented by this workforce. I would also add, one of the real challenges with pandemic preparedness, as everyone knows, is just the high level of coordination that's required among often very different kinds of government agencies and entities, and you have to be perfect, right? And so there's this pressure on high level coordination And even small gaps in that coordination can potentially have devastating effects. And so making sure there's continued effort to kind of make these connections between FDA and USDA and CDC and OSHA and kind of these different operational entities and federal, state, and those connections need to be really, really strong. And that's challenging because these entities don't always intersect. And when they do, it's not always clear how they do that. So kind of investing at the intersection of these existing entities is something else I think is important in the coming years.
Yeah, currently OPPR, the White House Office on Pandemic Preparedness and Response, is doing some of that coordination. But of course, the question is, what will be OPPR's role in the new administration as well? John, to you.
I see the same things. I think I would emphasize that this is a situation where the threat is a little bit unique from what has been seen in the past, and I think really requires a sort of a bringing together of a lot of different stakeholders that haven't before. And I think Jessica and Jen brought this up as well, that we have crop insurance for bird farms. We have infection insurance, and coming to people that work with cattle, that work with dairy, and bringing the same sort of support, I think is gonna be critical in something like this. If we think that cows are going to be the sort of that seesaw that moves the virus into being more capable of infecting humans, being able to talk with them, not in an antagonistic way, but in a we want to help way, and we would like to make certain that you guys get the help you need, I think will be important. Also, right, bringing FDA, USDA, all these people together where normally it's a siloed event, I think it's hard, but would be really important.
Thanks for that, John. I'm going to pick out some questions from the chat and then open it up to anybody to answer. There's one from Megan Multany, which we didn't cover, so I want to talk about this. Can you speak about what is known with regards to transmission routes? Is the inability to bring this virus under control in the U.S. dairy herds indicative of the gaps in understanding how it's spread? What else do we know about transmission routes?
I don't think we know a lot. I'm just going to be honest. There have been studies that are just not, they give us like a little piece of information in terms of genetic analysis, looking at relationship to wild birds. There was also a study of the practices of infected farms, but there was no controls to that study, so we couldn't. So although we saw the ranking of what practices were employed by infected farms, but there weren't controls to compare it to. And as an epidemiologist, I have to fail you for that test because I just can't say much about it. So this, I think, is a really important thing. I have not, and please, if anyone has surfaced information that I have not seen a very compelling explanation for how this thing is moving between farms. Obviously, the movement of cows probably plays a role. The birds may play a role. We just don't know. And not knowing makes it hard to stay ahead of the virus. It also makes it hard to protect the workers. And this is another reason why this testing of bulk milk needs to be much more comprehensive and much more frequent than some of the testing schemes that have been proposed, because otherwise we just won't be able to stop or prevent outbreaks on farms from occurring. It's possible that there are multiple different sources of movement of the virus, in which case it's going, potentially going to be harder to stop. I think there are some promising, insights from the poultry industry that suggests that some biosecurity measures can play a role. But again, I'm a human health epidemiologist. I just don't know that we can generalize too much from bird flocks that may be largely indoors versus cows that may have, more ground to cover.
Yeah, John, during COVID, you and your lab did significant work looking at transmission of COVID between campus and outside campus, right? Within campus. Yeah. You were able to accomplish that with phylogenetic trees by looking at how the virus changed and looking to see if you can get a sense of who is transmitting to who. What are the barriers to doing that with this situation?
Yeah, so great question. The fundamental thing that enabled those studies was buy-in from lots of stakeholders, right?
Buy-ins to get samples, to get testing?
Had testing being done at the universities. So within that closed system, there was regular testing of all the organisms there. Like, so like if there was a farm where all the cows were tested regularly and any positive was then moved to whole genome sequencing, right? That would give us a lot of power to get the natural history, the transmission data that Jen is referring to that we just don't have. But unless you create a situation where a farm, it feels like that's going to be an advantage for them, right? That's going to really gain in many important ways. I think it's hard to do.
And Jen, Jessica, your focus is agriculture. It is this environment. It is the interface between animals and humans from a One Health perspective. Can you speak to that transmission issue?
Yeah, I think Jen's point earlier is really apropos, that there probably is not one identifiable source of transmission among these facilities. There's probably many, from fecal contamination to milk products to potentially nasal shedding from these animals to wild bird introduction to carriage of rodents potentially and other mammals among these facilities. It's likely not just one thing. There could be droplet-based transmission. There could be aerosolized transition. There could be kind of inhalation concerns. There's probably a lot of different kinds of transmission opportunities. And it's an interesting academic exercise to try to parse it out and to try to figure out what exactly is coming from where and the contribution of what is, towards the aggregate. But at the end of the day, at this moment, to me, what seems most important is protecting the humans in these systems and looking to reduce the larger scale inputs to the human risk question. And that comes back to the workers and trying to identify how we protect the workers, knowing what we know now, and not leaving this full epidemiologic understanding of the system and viral movement within the system stand in the way of using the knowledge that we already have now to try to protect the workers.
Yeah, there's so many good questions here. I'm trying to figure out if we do the testing question or do we do the vaccination question. So why don't you do rapid shot? Let's talk a little bit about vaccination strategies. There was a question here about whether H5N1 could be folded into a regular flu vaccine. That's a little bit more of a virology immunology question. But I want to step back, Jen, and ask you just in general in vaccines, your thoughts about what our vaccine strategy should be right now versus if we see a transmission. Are we ready to deploy such a strategy?
So I think we should be offering vaccines to farm workers now. I think there is some work that needs to be done, such as through an investigation rather than just a commercial product. But I think we need to do that work. I think as we're learning from early in the fall, they announced, maybe it was even the late summer, they announced a plan to create an infrastructure to offer seasonal flu vaccines to farm workers. The idea being that, it's always good to get a seasonal flu vaccine, that this is in a risk population, but that you may be building an infrastructure for pandemic vaccination or even H5 vaccination. My understanding is that that's not really happening yet, that the states largely haven't gotten the vaccines or that infrastructure hasn't been built out. So that just shows you how hard it is. Even if we have vaccines theoretically available in the stockpile, there are still many, many more steps that have to be put into place in order to offer it again. This isn't going away. I think the hesitation to offer the vaccine to farm workers has been based in part on the fact that these infections have been mild. I would push back very strongly against that, which is that we shouldn't wait for farm workers to die or be hospitalized to try to protect them. So I think we should be doing that now. As for the broader public, this isn't a pandemic vaccination scenario yet. We hope it may never be a pandemic vaccination scenario. This virus would have to change in some way in order to cause a pandemic and to be something that we would likely offer the vaccine to people more broadly. It hasn't happened yet. We don't know what it's going to look like. So it's not possible to use this vaccine in a broader sense and have any idea of how protective it would be against the virus that people may one day, who knows, be exposed to. So just want to make that clear. I think sometimes when we're talking about vaccinating people now, they think it's just a runway to the future, and we just don't know if that's even going to be needed.
What a critically important point, because I do think that as much as we talked about the concern that this virus poses to all of us in clinical care and, in public health, that again, the risk remains quite low. So when we talk about the general population says, well, then why are you having a webinar on a random Monday talking about H5N1? And I think the thing is that we have to get better at the preventative side. And I think the alarm bells that you're hearing from so many public health experts is that to get better at things, we need to start getting ready for them before they happen. And the runway to this becoming a bigger issue, as you saw from the last hour, has been becoming broader and unfortunately paved in a lot more human infections. Any closing words from any of you before we call it a day?
I would just say we're talking about this on a random Monday so that we don't have to talk about it every day
Every day.
as a whole population.
Absolutely. Jessica or John, any closing words? Amazing. So we're going to call it, I think what we'll do is we'll do this again in the summer, another 6 months, and then we'll host another one, and then we'll sort of compare to see where we are now, or then compared to where we are now. Let me just turn around and thank everybody that attended today. Thank you for your really thoughtful questions, for the time you spent with us, and join us again next summer when we look at this and look at what's changed. Have a good day.